Antibiotics are compounds formulated to treat infections and diseases caused by bacteria by inhibiting its mechanisms from further action, which will allow the immune system to recover the patient's health. In today's society, antibiotic resistance is a major issue to medicinal practice, and this is due to its overuse in the following areas. Firstly, in the medical area, perhaps at a GP, a patient may not require antibiotics. However, they are still prescribed with it. Next, agriculture. Our animals are being fed with antibiotics, and our vegetable produce are being sprayed with antibiotics.
Antibiotic resistance is developed from, but not limited to, the following methods. Bacterial mechanism, that is the bacterial's own bodily mechanism, and this will be explained later. Secondly, binary fission, which is a cell division process undertaken by the bacteria, where more of the bacterial population is produced.
Conjugation is a process where one bacteria transfers its genetic material to another bacteria through a pilus. It is like a donor-recipient relationship in theory. Survival of the fittest. In this case, the strongest bacteria will survive and evolve to develop resistance against a range of antibiotics.
So think about it. Our animals and plant produce are fed with antibiotics. Through waterways and soil, the antibiotic resistance will be passed on to humans, us, who will interact with the waterways and consume those items.
In 2014, President Barack Obama ordered a new interagency task force charged with developing a national strategy to combat the antibiotic resistance issue. MRSA stands for methicillin-resistant Staphylococcus aureus. MRSA is a contagious bacterium that causes infections in different parts of the body, commonly a skin infection. MRSA can be seen anywhere, especially in locations such as hospitals, gyms, and prisons. Of the skin infection MRSA can be inflammation, pain, or red appearance. MRSA is a superbug because it has become resistant to numerous antibiotics, including methicillin, amoxicillin, penicillin, and oxacillin, thus making it challenging to treat the infection successfully. Next, we'll be talking about MRC1. In 2015, scientists have raised a serious warning of MRC1. It is a new gene found in bacteria that was recently discovered in the human body in pigs in China. The MRC1 gene exists on a plasmid, a small piece of DNA that is capable of moving from one bacterium to another, allowing it to spread the antibiotic resistance gene to other bacterial species. The symptoms of MRC1 depends on the bacteria it spreads onto. Transmission of MRC1 among bacteria E. coli can cause urinary tract infections, whilst among bacterial Bacillus pneumoniae causes pneumonia and other infections. Why is MRC1 considered a serious public health issue? Well, MRC1 gene makes bacteria resistant to the antibiotic colistin. Colistin is a last resort drug used to treat patients with multi-drug resistant infections. Also, colistin is cheap and easy to prescribe, which has significantly contributed to the overuse of this drug in the livestock industry in China.
So how do we address these problems and how can we stop antibiotic resistance? Well, the first step is to increase and promote public awareness. The most common problem of antibiotic resistance is due to inappropriate use in sectors such as agriculture and healthcare, whilst in health sectors, doctors prescribing antibiotics to common illnesses such as the flu, and patients not following the course of medication, such as stopping when you are feeling better, have contributed immensely to antibiotic resistance. To raise awareness through campaigns. An example of this would be the World Antibiotic Awareness Week that is currently going to be held on 16th to the 22nd of November this year. The next step is to reduce the incidence of infection. If we can prevent the infection and stop it from spreading, there is no need for treatment. A simple way to reduce the incidence of infection is through good hygiene and sanitation, as simple as hand washing. Most of the difficult to treat antibiotic resistance infections occur in healthcare facilities, such as hospitals. Hence, this setting is the best example where good hygiene and sanitation is crucial. And the third step is to strengthen the current knowledge of antibiotic resistance. Another strategy to prevent antibiotic resistance is to increase our understanding of the biochemical basis of the antibiotic resistance mechanisms. For example, there is a recent study which is looking into the development of rapid diagnostic identification methods. Since speed is the essence of dealing with bacterial infections, they found that the current system used to identify the organism responsible for infections is too slow, as it can take up to 2 days. You can see this is a huge major implication, since it takes 2 days to properly diagnose the bacterial infection and to give proper medication.
We have to do it soon. Penicillin began the antibiotic era in 1943. In just 70 years, we walked ourselves up to the edge of disaster. We won't get 70 years to find our way back out again. Thank you very much.